Good afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Associate Medical Officer of Health at the Middlesex-London Health Unit, Dr. Alex Summers, and the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow. Happy to be joined by you in the media this afternoon as well. And as always, we do invite you to submit your questions for today's briefing using the question form here on Microsoft Teams. Just click on the text bubble with the question mark, indicating your name as well as your media outlet and who your question is for. And finally, a welcome to those who are joining us this afternoon on Rogers Television or on the Rogers Facebook page or YouTube channel, listeners on Global News Radio 980 CFPL, and those who are watching on the CTV London website. Let's get to the opening remarks, and we'll start today, as always, with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. Today, I'd like to talk about inevitability. And there are two points to that which I'd like to focus. The first is the issue of vaccine passports or presenting proof of vaccination to participate in most aspects of our society. That is inevitable. It's no longer a question of if, truly becomes a question of when. It was 1 week ago today I made my position clear for strong support for this approach, both as a means to drive vaccination rates higher and to better protect those who've done the responsible thing. During that time, in just 1 week, I presented a motion at the Ontario Big City Mayors regular sessions that we have on policy, who endorsed the policy for very strong commitment and recommendation of a vaccine proof of vaccine mandate. Now that's a group of the 29 largest mayors of Ontario cities with populations of 100,000 people or more. As you know, Western University and a number of other post-secondary institutions have mandated vaccines for anyone who comes on campus, be it students, be it faculty, staff, guests. And late last week before the election call, the Prime Minister announced vaccinations would be mandatory for anyone boarding a flight in Canada, taking a train, or going on a cruise. In addition to that, there will soon be mandatory for all federal government employees and those who work in federally regulated industries. It's about 1.5 million people. As I said, it's a matter of when, not if. Our current patchwork system is inevitably replaced by a province-wide mandate. So, question to those who still haven't been vaccinated, why wait? Get your shot. Book your second one for just weeks later. If you want to go on vacation, go to a concert, a sporting event, a movie, a restaurant, it's blatantly obvious that proof of vaccination will be a requirement. So why not act now and save yourself the hassle later and save people's health in between? Another inevitability is this: based on how contagious and how easily the Delta variant spreads, if you're not vaccinated, it seems inevitable that you too will eventually become infected. Even if your symptoms are minor, you could still become a so-called long hauler. You could spread it to someone who's under the age of 12, someone who's immunocompromised, or someone who can't receive a vaccine for legitimate medical reasons. The risks just aren't worth it, while the benefits of getting vaccinated are obvious. Since July 5th, mind this, 89% of all cases in London Middlesex involve those not fully vaccinated. Almost 93% of hospitalizations during that time were not fully vaccinated. And all deaths over that same period were among those who had not had 2 shots. The evidence is undeniable. The choice is obvious. Just get your shots. That's it for me. Over to you, Dr. Summers, please.
Thank you, Mr. Mayor, and good afternoon, pardon me. I'm not quite there yet. Nice to be with you again today, and I certainly bring greetings from Dr. Mackey. The Middlesex-London Health Unit is reporting 17 new cases today, with 21 reported on Sunday and 20 cases reported on Saturday. Those are significantly higher numbers than we would want to see and demonstrate an increasing trend in COVID cases in our region, a trend that is being seen across the province. This trend is being driven amongst those who are unvaccinated or those who are in close contact with those who are unvaccinated and who subsequently become positive. An example of this is an outbreak that was declared at a downtown restaurant and bar called Delilah's, declared over this past weekend. 15 primary cases have been associated with that outbreak from people that were in attendance at that facility between August 5th to 7th, so the evenings of August 5th, 6th, and 7th. Of those 15, 7 were fully vaccinated. Breakthrough cases, or cases amongst those who are fully vaccinated, are inevitable when the COVID virus continues to circulate amongst those who are unvaccinated. The good news for those who are vaccinated are that if you get COVID, you're significantly less likely to be hospitalized and remarkably less likely to die. However, you could still become infected with COVID-19. We also saw an outbreak at a retirement home in our region, the first outbreak in a long-term care or retirement home since June. That outbreak is 2 cases, both fully vaccinated, and is remaining small because the facility's staff and residents are vaccinated. The impact of the vaccine is absolutely remarkable, but it does not necessarily mean that if there are many people in our community who are unvaccinated, that COVID-19 will not circulate, or that those who are fully vaccinated may not be exposed. The latest estimates from the co-chair of the Ontario Science Table are that if you are unvaccinated, there is an 80 to 90% chance that you will get COVID-19 within the next 6 to 12 months. Further to the mayor, the decision now is not between getting vaccinated and not getting vaccinated, it's between getting vaccinated and getting COVID-19, period. The single best thing that you can do for your health now is get vaccinated for COVID-19. The second best thing you can do for your health right now is make sure that those who you are spending time with, particularly in indoor environments, are unvaccinated. Those who are unvaccinated have an 80 to 90% chance of getting COVID within the next 6 to 12 months. That also means that if you're spending time with those who are unvaccinated, you have an 80 to 90% chance of being exposed to COVID-19, even if you are vaccinated in the next 6 to 12 months. There's a challenge out there for those of us who are fully vaccinated. The message from the health unit, our hospital partners, our municipalities, our political leaders has been very clear: get vaccinated. And I think many, many people, as we can see from the rates in our community, have taken up that call. However, there may be folks who aren't listening to us right now. They may be people that you know in your community, in your home, in your workplace. It's up now to us collectively to challenge individuals to get vaccinated, not just for themselves, but also for us. As we talk about returning to school in the fall, as we talk about indoor gatherings, more and more, the only way to ensure that those environments remain safe against the Delta variant of the COVID-19 virus is for us all to get vaccinated and to expect that people in those settings are also vaccinated as well. We may see, as the mayor has noted, an increasing number of mandatory vaccination requirements be put in place for any indoor gathering in many different settings over the next little while. And indeed, we would anticipate that some degree of proof of vaccination is around the corner. However, why wait? In the meantime, go and get vaccinated. The evidence is there, the reasoning is there, and certainly in the midst of rising case counts as we approach September, the imperative is upon us as we speak. Thanks for joining us today, and I'll hand things over to Dr. Dukelow from London Health Sciences Centre.
Thank you, Dan, Mayor Holder and Dr. Summers, and thank you to everyone for having me here to provide an update on the current COVID situation at LHSC. As of this morning, we're caring for 8 COVID-19 positive inpatients, fewer than 5 of which are in critical care. I would like to start by thanking our media partners for your assistance during our chiller issue at University Hospital last week. Thank you also to our regional hospital and home care partners for their support. Most importantly, thank you to our patients that experienced rescheduling of their appointment or procedure. We know this is more than an inconvenience, and we apologize for the disruption. The system continues to function now, and we resume surgeries and non-urgent and emergency clinical procedures. We are also once again welcoming visitors back to University Hospital, as we would have been just over a week ago. I know you're interested in mandatory vaccination at London Health Sciences Centre. Our current vaccination rate for staff and physicians is about 70% for the first dose and 63% for the second dose. This is a voluntary reporting process, and the totals may be higher. frankly, they need to be higher, both in the walls of LHSC and in our community. Our other hospitals have announced mandatory vaccine programs over the last couple weeks. The first part of all those hospitals' policies is an attestation step. LHSC, as of 4 weeks ago, started the attestation reporting process in a mandatory fashion through an online learning module for staff and physicians. This is separate from the self-reporting to our occupational health department. Of the staff and physicians who have completed their attestation, 93% say they've been vaccinated. We are also closely monitoring the ever-evolving provincial discussions about mandating vaccines for healthcare workers and other populations. In the meantime, we are evaluating our own policies and procedures and considering next steps after the current mandatory attestation at LHSC gives us a true picture of the vaccine status of our staff and physicians. We will keep you updated through these briefings. Please take the comments of Mayor Holder and Dr. Summers to heart. I worked in the Vic ED this past weekend. I had the opportunity to see patients, but also to talk to my colleagues. We are all starting to see more and more patients with COVID. The majority of them, especially those that are getting admitted to hospital in our ICUs, are unvaccinated. The vaccine will protect you from severe illness for the most part and may protect you from getting COVID. So as Dr. Summers said, basically you need to know who you're around to keep yourself safe and your family safe. Thank you for taking the time to attend, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Summers, and Mayor Holder. We do have several questions, and we will, I know that some aspects of them have been touched upon as we've been going through the opening remarks, but I will ask the whole questions and we'll revisit some of that information where it does come up. So let's go to our first question, and it comes from Jane Sims at the London Free Press. Dr. Summers, it's for you. Dr. Summers, can we get an update on the outbreak at Grandwood Park, as well as the outbreak at Delilah's? And you've already mentioned that a little bit in your opening remarks. Are all residents and staff vaccinated at Grandwood? Of the people identified from Delilah's, how many are unvaccinated and how old are they? Have there been any cases beyond the 15 reported on the weekend? So lots in there for you, Dr. Summers.
Yeah, always good questions from Jane. Thanks for that question, Jane. As mentioned, the Grandwood Park outbreak is still at 2 cases, both fully vaccinated. No additional cases have been identified at this time, and we anticipate that that outbreak will be resolved within a matter of days. The Delilah outbreak remains at 2 primary cases, 15 primary cases, as well as 2 subsequent secondary cases, which are cases that weren't at Delilah's but were linked to some of those primary cases. Of those 15 primary cases, 7 were fully vaccinated. The 2 secondary cases were both fully vaccinated. So again, we are seeing evidence of transmission amongst those who are fully vaccinated. And again, that's not because the vaccine is not acting like we expect it will. It's doing its job. However, when you have a large amount of exposure from unvaccinated individuals who may be infected and close contact like we may have seen at a setting such as this, outbreaks will happen and cases will happen. The age of the group at Delilah's, they were predominantly within that younger age bracket, under 25. We're continuing to get a breakdown on the numbers so that we can fully present that information. And as I mentioned, no additional cases at Delilah's beyond those 2 secondary cases have been identified at this time. Thanks, Dan.
Thank you very much, Dr. Summers. And let's go to the next question. And it's a follow-up from Jane Sims. Dr. Summers, do you think the Delilah's outbreak would have been prevented had there been a vaccine passport program already in place?
Thanks again for that question, Jane. I believe that the outbreak would have been smaller in magnitude, if not prevented, if proof of vaccination was required for participation in these types of events. And again, we actually have case in point of that, where you've got Grandwood Retirement Home that's an outbreak that began and stopped at 2 cases. In contrast, you have a larger outbreak, including many more unvaccinated individuals. So the more that we ensure that everybody, absolutely everybody in a congregate setting or in an indoor group setting is vaccinated, the better we will be prepared to prevent or minimize the size of these outbreaks.
Thank you. Let's go to the next question, and it's a final follow-up for you from Jane Sims. How many thawed Moderna doses expired on August 12th? Has there been any uptick in vaccination rates since the federal government announced it would be developing a vaccine passport strategy?
Good questions today, Jane, as always. Regrettably, approximately 10,000 Moderna doses expired on August 12th. Fortunately, we were able to move through significant amounts of Moderna product prior, so it was less than we projected, but still, unfortunately, we weren't able to find candidates for those vaccines. We have yet to fully appreciate a notable uptick in appointments since the federal announcement. But as the next couple of days unfold, if there are more announcements around requiring vaccine to participate in certain events, we will see those rates go up. I see Mayor Holder may have some comments on this. Mayor.
Ever see that movie Network with Peter Finch, Dr. Summers, where he comes out onto the balcony and he says, "I'm mad as hell and I'm not going to take it anymore"? Well, aren't we just mad as hell? The 10,000 doses of Moderna go into the garbage when they did not have to. I mean, that's the most tragic of all circumstances. And those 10,000 shots that would have prevented 10,000 Londoners from getting sick and getting COVID are in the garbage. And I'm mad as hell. And it makes you wonder, for those with that reluctance, and look, we've heard this issue. Do we push? Do we prod? Do we kiss? What do we do to encourage those who aren't sure? And then the other question becomes, what do you do, if anything, with those who just choose not to? Well, they may not do anything. What if we did nothing? What if when we got sick, they got sick? We did nothing. That is not our way. It is not the Canadian way. It is not the London way. But I'll tell you, there is a growing frustration amongst those who are vaccinated and have done the right thing to say to those who have not, get in the game for the sake of all of us. It's 10,000 shots being wasted like that. That's a life and death decision. And that's the tragedy of all this. Dan, I'm going to stop because I better.
Well, thank you for sharing your thoughts, Mayor Holder. And that was something that we've been working on for a while, to try and increase the uptake of those vaccines. And we know that there were a number of them that were able to be used, but as Dr. Summers mentioned, unfortunately, a good number that were not. Let's move on to our next question. Sawyer Bogdan is joining us from Global News Radio, 980 CFPL this afternoon. Dr. Summers, we are entering an election campaign amid a new surge in cases. How will the Middlesex-London Health Unit ensure election activities, from rallies to voting stations, don't lead to a surge in cases locally?
Thanks for that question, Sawyer. We do know that Elections Canada has been working diligently in anticipation of the election to ensure that processes are in place for election day or for voting day that would ensure minimal risk. And certainly that can be ensured in those environments. Physical distancing, no problem. Masking, absolutely required. And I think vaccination status for the staff working in those sites should be necessary. Those types of interventions can absolutely ensure that we won't see a surge due to voting. I do not see that as a high-risk activity if those steps of masking, physical distancing, and vaccination are in place. With regards to things like rallies, every single activity is still under the parameters of the provincial regulations for Step 3. We're hearing rumblings that Step 3 is going to be with us, maybe even all the way up to the election, and ensuring maintenance to those regulations will be absolutely necessary. Also, if we're looking at door-to-door activities and visits from candidates, it's critical, of course, that masks are worn. And as certainly to all our candidates, I hope that you are all vaccinated, because that's the way that you can protect your constituents or presumptive constituents as you're monitoring and moving through the neighborhood.
Thank you very much, Dr. Summers. And a follow-up question from Sawyer Bogdan. Dr. Summers, what do we know about the Lambda variant, and have we seen any cases locally?
Thanks, Sawyer. Another good question. The Lambda variant has not yet landed on our shores from the cases that have been sequenced, so we continue to monitor that. All the new variants and mutations of the COVID virus, the coronavirus, cause some concern because, of course, we've seen how different these strains can operate and what an impact they can have on rates within our community. So we continue to monitor that closely, as well as international and federal guidance around those variants.
And to that point, Dr. Summers, we have seen the Alpha variant, of course, was the predominant variant for weeks and months. And of course, now we don't see it very much at all. And really, most of the variant cases that are coming through are of the Delta variant.
Yeah, quite correct.
All right, let's move on to our next question. Sophia Rodriguez from CBC London has a question for Dr. Summers. How is the planning going for vaccination clinics at schools in September, as announced by the province today?
Thanks for that question, Sophia. Preceding the provincial announcement, Middlesex-London had already been working to develop the capacity to deliver COVID vaccine in schools this fall. So planning is already underway. We continue to work with our school board partners around anticipation of those plans. Quite frankly, we were independently moving ahead with many of that even prior to that provincial announcement today. Our hope is to really focus on communities that are in schools that are in communities where vaccine uptake may not have been as high as other neighborhoods, but we will work our way through those schools throughout the fall.
And a follow-up for you from actually from Sawyer Bogdan now on a similar topic, but it goes into a little bit more information that Sawyer is looking for, Dr. Summers. The Ontario government has said COVID-19 vaccination clinics will be set up in schools and nearby locations, and that boards will be required to host the clinics. What does this mean and look like for us locally?
We continue to, again, thank you, Sawyer, for that question. The province's vision for this program has not yet been articulated to us. We saw the release at a similar time to you. However, fortunately, we are well underway with our planning for delivering vaccine in schools staffed by MLHU-run clinics. So we'll be working, with our staff and supporting the schools through that. So again, plans are well underway for this, and it should mean that we'll have more doses available to people closer to their homes and certainly closer to their schools as we go into the fall.
Thank you very much, Dr. Summers. And this will be the reminder for the media who are in attendance this afternoon. If you do have questions you have not yet asked, now would be the time to get those in, as we are getting down to the end of the questions in the queue. And also a reminder as well, if you have not visited the Health Unit website, to see the list of community pop-up walk-in vaccination clinics, you can do so. Visit healthunit.com/novel-coronavirus, and you will find all the information there, including the full list of upcoming walk-in pop-up vaccination clinics across the region. The next question comes from Merrick Sutherland at CTV News. Dr. Summers, with the numbers in the U.S. showing the Delta variant spread within school settings, is there a concern of a similar situation occurring when schools start here again in 3 weeks? And Merrick is saying this is particularly in relation to elementary age students who cannot get vaccinated.
Certainly, as school returns this fall, it is so important that we're able to continue with in-person learning. We know that children have paid the heavy toll for all of us with not being in class in order to keep COVID cases down. And now it's our part as those who are older than being in elementary and secondary school to do our part, which is to get vaccinated. The best way that we can ensure that schools are lower risk for COVID transmission this fall is for adults who care for children, be it in the school environment or outside the school environment, to be vaccinated. The risk of transmission of the Delta variant within a school environment is certainly there, absolutely, and it is certainly there amongst elementary age children who are not able to get vaccinated at this time. It is. However, we can limit that risk in a number of different ways. The predominant way by ensuring that those who can be vaccinated, parents, guardians, teachers, staff, siblings. If they're vaccinated, it means that those elementary school kids who cannot get vaccinated are not going to be exposed and therefore won't expose each other. The other critical thing will be masking amongst elementary school students of all ages. Kids have proven to us time and time again that they can tolerate wearing those masks, making sure that people aren't going to school while sick, ensuring that outdoor activities happen and that we've got good support in the schools to make sure that symptoms are identified early on. Those things, plus our ongoing case and outbreak management, which MLHU will continue to support our school boards and private schools in partnership with Southwestern Public Health. Those will ensure that the risk is minimized in schools as much as possible come this September. It's so important that kids get back in the classroom and remain in the classroom. And so we are really looking forward to supporting that. And again, as an adult, it's time to step up and be the adult and go get your vaccine so that those kids can remain in school in a safe way.
And Dr. Summers, you mentioned a number of things there, including ensuring that those who can be vaccinated get vaccinated to protect those kids in the school. Merrick Sutherland did have a follow-up question. Does more need to be done to prepare for and to keep schools safe this year?
Critically, everyone who is eligible to receive the vaccine in a school environment should be vaccinated. That is the number one thing that we can do to ensure that schools are as safe as possible. I want to highlight that there will be cases in schools this fall. There will be. However, the risks of other activities outside of school is also there, and the risks of being out of school are too high now for these kids. It's time to go back to school. It's time to go back to in-person learning, and ensuring that everybody who's eligible to get vaccinated is the key step in all of this. Hopefully, the vaccine will get approved for those under the ages of 12 in short order. And certainly over the next number of months, we would anticipate that would happen, but it's not going to be there in time for September. And so it's important that everybody else who does have that opportunity takes advantage of it.
Thank you very much. And we do have one final question. Dr. Dukelow, it is for you, and it comes from Jane Sims at the London Free Press. Dr. Dukelow, why hasn't LHSC made staff vaccination reporting mandatory?
Thank you very much, Jane. So keeping our team members and patients safe is extremely important at London Health Sciences Centre, and we've been working very hard to promote staff and physician vaccination through education. I talked about attestation in the opening remarks, as well as bringing the vaccine on site to the hospital to make it easier than ever. That being said, like I also mentioned in the opening remarks, we need to do more. We need higher staff vaccination risks. Mandatory vaccines in a workforce like we have in a hospital are not without other risks that we need to consider carefully prior to taking the step of going to a mandatory vaccination. Like many industries, we are short-staffed. We have people choosing to leave the healthcare industry as they're exhausted from the pandemic, and they have lots of options. So solidarity with our regional partners and other hospitals and other healthcare sectors is extremely important. Hence, to date, we have taken an approach of education, promotion, conversation, and now attestation. However, like many of you, I watched the news on late Friday evening, early Saturday, of a pending announcement from the provincial government on Tuesday. We're also anxiously awaiting that announcement and hope that it will be consistent with what many of us believe, and that is that almost all healthcare workers in the hospital system and other sectors will need to get vaccinated or have some other alternative like mandatory regular testing. So Jane, we will likely get to that point. It's just the path, how we get there is not clear at this point in time.
Thank you very much, Dr. Dukelow, and that does bring us to the end of our questions for this afternoon's virtual media briefing. I'd like to thank you, as well as Dr. Alex Summers and Mary Holder, for your time this afternoon, for your insights, and for your comments. And I'd like to thank you as well for joining us today. We will be back with our next virtual media briefing on Thursday. That is the 19th of August at 2 p.m. We will be here. We hope you will be able to join us. So enjoy the rest of your Monday afternoon. We'll see you on Thursday afternoon. So long for now.